Oh my gosh, I'm so excited. So, welcome everyone. Good night. Hope you guys are still up. We just had a wonderful discussion, pre-discussion for this post-discussion. Hi, I'm Charmaine Jackman from InnoPsych. I'm here with two of my friends, Dr. Shani Turner and Dr. Vanessa Prosper. And I know Dr. Prosper, Vanessa was a fan of the show before. Shani is just getting into the show, but she seemed as energetic about it as we are. So we're gonna have a lively conversation tonight. So why don't we have you guys just introduce yourself first? Just say a little bit about your name, kind of the clients you work with. If you want to disclose kind of where you work, that's fine too. And maybe talk a little bit about maybe your theoretical orientation. You want to start, Shani?
Yes. Hi, good evening, everyone. My name is Dr. Shani Turner. I am a clinical psychologist by training, and I am a assistant professor at William James College in Newton, Mass. There I work in the African and Caribbean mental health concentration, and also the director of a program called Pathways that brings our PsyD students into Boston Public Schools. Prior to my work in academia and kind of on the side, I enjoy working with children and adolescents and families. So I've done a lot of work in the Boston area in community health centers, and that is definitely a true passion of mine. I would say my theoretical orientation, I've been trained in kind of a cognitive behavioral approach. I think that over time, some pieces of a humanistic approach have kind of stuck with me, just as far as kind of inner feeling, self-image, that kind of thing. I think there's a room to add a couple of those things into my toolbox, as well as kind of just being trained in trauma-informed care as well with the population that I love to serve. So that's me in a nutshell.
Excellent. Awesome. Dr. Vanessa.
Yes, hi, I'm Vanessa Prosper, and I'm a counseling psychologist. I graduated from Boston College. I currently work at Boston Latin School. I have expertise in child and adolescent psychology and school-based clinical work. I am also adjunct faculty at different universities here in the Boston area, as well as I've had a private practice, I can believe now, for 13 years. So where I see not only children, adolescents, but also adults and young adults. In terms of my theoretical orientation, well, I'm going to say eclectic, because it's really a lot of everything. I think over not only through my graduate studies, but also through my clinical work, just constantly informs me in terms of like the best theoretical approach. So I would say definitely looking at a lot of the environmental variables that are contributing to the client's developmental outcomes and what they're presenting with, and really looking at like all the different system around the individual, and then really weaving in like psychodynamic theories in terms of like how does your childhood and your relationship with your parents impact you, but also beyond, like your relationship with your peers, and also kind of like what you have internalized, how you've been socialized, and how do all the isms impact you. I mean, I think it's kind of like a lovely mixture of like everything. And so that's kind of like to understand what is going on with my clients. But in terms of like interventions, like I really love like cognitive behavioral approaches. So it's a little bit of everything, but I like to also tailor it to what the client presents with, their personality, and what would work best for them.
Excellent. Mm-hmm. And so I'll do my intro again because I didn't talk about those things. So in addition to working with InnoPsych, I also have a private practice, which I've had for over 16 years. And so I work at a high school similar to Vanessa, working with adolescents in an arts high school in Boston. But I primarily see women of color, Black women specifically, in my private practice, and some teenagers. So, and my practice is primarily CBT, or cognitive behavior therapy. Do a lot of mindfulness, anxiety work, depression, but I also bring in other styles as well into the work. So awesome, great. So we have a lot of connections in terms of and who we work with. So, so we have, and Dr. Brooke Taylor should be here joining us for this session, right? So, one is awesome to see a Black woman in this role, right? So, like, we're here sitting just embolizing that. So, we just want to shout out HBO for doing that. So, we're going to start with Eladio. We said we're going to try to do this for 30 minutes. So, let's see.
Okay.
So Eladio is, I'm assuming, a Latino man because he's speaking Spanish in the session. So I was taking my notes, right? Like we're in session. So he works as a home health aide. During COVID, it sounds like he was stayed at the people's home. He talked about a history of insomnia first, but then disclosed bipolar. Very clearly there was some secrecy around that because he worried about stigma around that diagnosis, and I can totally understand that, right? The stigma around that bipolar, and sure he could keep his job. So that is what, and he was looking for referral to a psychiatrist. So we don't know yet, but I think she's a psychologist.
Yes.
We were saying we hope as the show uncovers. What else came up for you in terms of just locating the client based on what was shared in this first session?
Some childhood pieces definitely hit me right away. So him talking about his experiences with his mom and a conversation he had with his mom about the death of the sister or the death of a child. And the fact that at 6 years old, he can remember his mother having that distance, and that after that, he never had a relationship with her. In his words, like he never had a relationship with her after 6. I mean, just such a profound moment, and he didn't want to stay there. Like she tried to kind of pull at those pieces, and he really didn't want to stay there. And I enjoyed watching the dance that she kind of did, the therapy dance that she did with him, where she would allow him that space. But I also really, really thought about her boundaries with this patient, that this patient needed a good set of boundaries up front. And the fact that after one session, because she had one session with him and then answered that phone at midnight. This is too much. You just, I don't know.
Because that was just the second session. Was that the second session, or she'd had 2 sessions?
I think number 2 is what we watched.
You think so? Either way, it's early.
Yeah. Because it wasn't clear, because she said that she mentioned after 2 sessions. So you don't know if that was session 3 or session 2, but regardless, me watching in the beginning, I was just kind of like, this is weird. But then I thought maybe it was like a patient she had for a long time. And I was like, okay, maybe she's picking up because it's an emergency where he's, it's about his safety. And then that wasn't that. So I was really surprised when she said like it was after 2 sessions, like clearly, I wrote down like no boundaries. Like this is
that's why I had boundaries too.
I wrote down boundaries.
Big word was boundaries.
And then did anyone catch that in that session? I'm gonna go back and watch this because I think that at the evening when she answered the phone, I wrote down boundaries, and then she had disclosed about her dad.
Yes.
I said, "Oh, ma'am!" Like at midnight.
The dad? No, she disclosed about the dad the next day in the session. I think, right?
Yes. No. Okay. So this is how it went down. So she picked up the phone. So that's definitely a violation of boundaries. But then during the session, when she apologized and was like trying to reestablish a boundary and acknowledged that she shouldn't have answered the phone, and then I think he asked something like, "Oh, how come you were up?" or "You were up as well." Shut it down right there, like kind of like, but then she went in, she's like, "No, because my father died."
No, he said something like, when I brought up grief, you went quiet.
Oh, you're right.
And then my father died. Yeah. So it's interesting because I was saying to Shani, like he seemed experienced with therapy. So right on, I picked it like
Yes.
he's been a therapist. He's not new to this game because even the way he was related.
Well, he likes to read. I also thought maybe because he enjoys reading, like, or he seems very intelligent, and that he likes to kind of soak up that kind of information. And so I also could see him being a person that like reads this information, or when he was given this bipolar diagnosis, maybe he read on it, and is able to kind of do again that dance in the session with her. But he's looking to cross boundaries.
Oh, yes. Yes.
So back on that. So one, this is early on in the session. She picked up the phone. It also, the image, right? He was in front of a pool. So I don't know what was there, like a subtle message like he might jump in the pool.
Yeah,
like,
me too. Like the suicidal.
Like, was there a suicidal thing?
Yeah. Mm-hmm.
Do you typically? Well, our clients have our phone numbers, right?
Mm-hmm.
So why did he feel he could call her at that? I mean, I assumed it was late. Why did he? Did she give permission? She talked about you could call
anytime. He said that. You told me I could call.
What I'm curious, what about the patient? What about him made her give that away? Like I'm curious, like what happened in that first session?
But it's also in the way in which, well, there's two things. It's like, did she say, because I know I can say to my patient, like, you can call me, but only if it's an emergency, and I will define the emergency. If you are feeling like you are not safe, i.e. you're going to, you have intentions of ending your life or harming yourself, or something very critical and life-threatening, right? And so I wonder if she was clear. And it could be that she was clear, but then he kind of, because he's so smart, said, well, you said I could call anytime, like it playing with semantics. So there's something there that we don't know in terms of like how the exchange went, because it could have gone both ways.
Yeah.
And that's why, I mean, this is our job, right? Like we know that this is important to establish on that first session. So we're missing that piece. And I say from the perspective of working with adolescents, they do have my cell phone number, right? And they have a cell phone number that they can absolutely text up until a certain point. And that is established on the first session. You are not going to text me after 9 o'clock and expect a response. If you text me after 9 o'clock on a Friday, you're probably not going to get me till Monday. If it is an emergency or a medical emergency, I need you to allow your parent to step in at that point, because then I get a parent call. It's different than the adolescent texting me, right? But with this being an adult, I understand that that's very different. But if they didn't even set that up, if she just left it like, oh, you can call me, that's not good care. That's just poor boundaries and not good care.
And even with my adolescent clients, they have some of them have my number, most of them have my number now because of COVID. But the only time I would say you can call me is if I know they're in crisis. And then that's like, if you need to talk to me, after hours, you can give me a call. But typically, like there's a thing about like we use the phone to communicate in school if I need to pick you up for your session, blah blah blah. But it's not this carte blanche where you can call me whenever you want to. Bless you.
Thank you.
And for those watching, if you have comments, please drop them in the chat, and we'll comments or questions. We love to make sure we are including those in the chat. Yeah.
Yeah.
So
one more thing.
Go ahead.
I thought that what I was saying with the nighttime scene, what I'm going back to watch is, I think at one point she called him honey.
You said that. I didn't hear that, but I had.
Did you hear that?
Yeah.
I think I heard. I can't remember whether it's honey, but it is an endearing term. But also the way he calls her as well, because when you were saying like Eladio as like boundary thing, did he say like? I know it's something. I don't know if it was mamacita. Like it's just very.
Yes. He did.
And so it's like what
very
is
playful.
Yep.
I don't like it. No, I don't like it. It's And he has so much work that he can do. And then he made it once they had their like real session, right? Not the phone call. You could see for him to do that good work, there has to be clear boundaries. And he has to have other resources other than her available to do like that. Like he needs more people on the team. So for instance, when I heard him saying like, he sees her almost as family, and he sees his mother in her. The mother that he doesn't have a good relationship with, that he wasn't connected with. No, what he sees is, if there was supposed to be someone I could talk to and I need someone to talk to, you're it.
And that's not
That's not gonna work. That's not gonna work. No, because we got 45 minutes once a week. That is not going to work for you. What you're looking for as far as a family, I'm not going to be able to do that. So let's pull that apart. Let's pull that apart, because I'm your individual therapist for these sessions, and I want to build a rapport, but it's a therapeutic rapport.
Right.
It is not your family. It's not to replace that for you. And so how do we talk about healthier ways that you can set that up with the relationships you have now? So I'm hooked, because I gotta see.
Right. And the transference is, for those new to therapy, or it's when sometimes clients attach relationships or attached to you in some way. And I had that in the school. I feel like kids want to call me mom or auntie, and like you have to set clear, and clients might do that, right? You might remind them of someone in their life, and so they start to form this attachment that you don't want to continue to facilitate.
Yeah, and especially in the case of Eladio, like he even referred to, that's why I want to go back, because sometimes I'm like, oh, I missed something. But I think he was saying kind of like the other people that he used to take care of, like he became attached to them, right? And that became kind of like his support, but then he ended up passing away. It's like thing all the time. So here he is finding this therapist that he connects with, and then he has this broken relationship with mom. Because to what you were saying, Shani, it's just like, he was like, you remind me. I don't think like that's what he wished his mom was to him. Right. So part of the treatment goal, she's really going to have to help him establish social supports outside. Otherwise, then she's going to become everything to him.
Yeah. And at the end that's what he said, right? Like, you're not going to leave me. You're going to be with me. You're not.
Right. And that session ended really abruptly, right? Because he got pulled away.
Yeah.
But at the point, he was talking about all what he's looking for in this relationship.
Yeah.
So, and I wrote down abandonment as well, right? So
he did
that abandonment / rejection from his mom, but then all the people that died, right? It's almost like they left him.
Yep.
So this will be very interesting to see how this plays out.
Yeah.
All right. Anything else there?
I like that she said a statement to him, and I was like, oh, I got to use that. She said that he had 2 decades of wired behavior and thoughts. And I was like, yes, I'm stealing that for the next one. Like,
I was the same thing. I was like, ooh, that's beautiful.
That is it was just such a, you're looking for me to do this in 45 minutes, and you're coming to me with decades of wired cognition behavior. I need you to remove this idea that I'm going to be able to help you get through that in an hour or 2 or 3. It's decades of work. And so you've got to be patient with this process. Oh, I loved it though. It was just the way she said it.
We got to see who the writers were. They must have a purpose.
They have to. They have to.
That's why at the beginning of the session, I didn't think that he had a lot of experience with therapy, just because he was just like, he wanted a quick fix, or I thought he just wanted to be in therapy. Also the stigma, like he just wants to be in therapy so he can work, so he can make sure that he doesn't lose a job. But then later on, when he says that he has bipolar 1 disorder, I'm like, oh, wait a minute.
Yeah.
So it's very interesting. Like, what game is he playing?
Yeah.
So there was the piece too about like, she almost was accusing him of like med seeking, right? So,
yes.
So there's a piece there too. We'll come back to. I know we have to move on. And then I did want to note, like he talked about the dream, right? And seeing his dead sister.
Yes.
Like there's a cultural component to that. I think in my culture, in Latinx cultures,
Latinx community.
and maybe also, I'm sure in Haitian culture too, right? This ability to communicate with spirits.
Yeah.
And I think in traditional, like when I was trained, I might have been taught to think of that as schizophrenia or paranoia, but I've come to understand sometimes, and I've heard clients talk to me as like, it's a gift, right?
Yes.
My grandmother has it and I have it, and my mom, like this is this, and it's valued. It's something that's valued. So I was actually interested that when he shared it, like he talked about his mom being scared of him in a way or pulled away. So, and again, like you said, he was 6. So who knows what his understanding of that. I think she also made that point, like you were 6, so you might have made this connection that might actually be true. But I was just curious how they named that spirit, but that the mom pulled away from it. So want to see where that plays out. And then she talked about this is not a results-oriented process. And I was like, and he was like,
he called her out though, right away.
How come people come to you, they don't get results? Like what kind of game is that?
Yeah.
Just think about that. I mean, she was kind of talking about her theoretical orientation, right? But clients come to you, they want something.
Absolutely.
They want to resolve something. Yeah.
I was curious why she phrased it that way. So
I don't know, but I love that he called her out. Like, what do you mean? Like, people come here all the time for healing with relationships, so they need to get back to work. Like, some people may need 6 sessions, some people may need longer. Like, people do come with the expectation that some hope, some guidance, some relief, and that is why people come, and they do get that.
I wonder if she wanted to say like it's just like it's really a lot about the process. The process will heal you, but I don't know if that's what she meant. But but she should maybe rephrase it because it can lead to confusion and misinterpretation. Yeah.
Ooh, all right. All right. So now we're gonna shift gears to Colin.
Yes.
All right.
Let's go.
Colin is a white male who came to session with his probation officer, we assume. He has court mandated therapy for 4 sessions. So this is in COVID. He's vaccinated. Nobody's wearing masks.
They're in her house.
We have to talk about, I don't know if you talk about her fashion, but I do love her outfits. And her house. Now, we were talking about that before we got on. So let's do a little bit of that first before we get into Colin. So her house is slamming, right?
Oh my God, love it. The view, the architecture, the furniture. It's beautiful. It's beautiful. It's beautiful. And I wasn't clear in the first one, right? With the first session that was really, I was like, oh, is this her house? But now to see that this is her house and you're just going to have your court-ordered patients in the living room, ma'am? No. What are you doing? What are you doing? Why are your childhood photos here? The one free, okay, we're not going to talk about this, right? The one free client she has is court-ordered white male, No,
right. That's what I was thinking.
We're not going to say nothing.
No, we just said it. But it's interesting because there's a lot of race
that he pulls out
conversation in that relationship, which is going to be good. She has a sense of humor, which I love.
Yes.
I love. She was saying like, Black people aren't scary when you're Black.
And then he sunk in his chair. He's like, that's not what I meant.
Yeah, that was good. That was really, really good.
Yeah. So so Colin is court ordered and all right, court ordered white male from prison, right?
Yeah.
We're flipping the script right here, HBO. Okay.
That is true.
But I wrote down boundaries.
Again.
And she brought up her father again. Clearly, this is something that she's going to have to work through. I don't know if they're going to do like the previous seasons of where she's going to
go to therapy.
Go to therapy.
I think
it's going to be in the email.
Yeah, it's going to be different because they only have 4 episodes per week. And I think prior episodes, they had like each client, I think they had 5 clients.
Yes.
4 clients and then the therapy session.
Yeah.
With his therapist.
Mm-hmm.
So I don't know where that's fitting in. We'll see tomorrow. But yeah, so let's unpack Colin. What's Colin really dealing with? So we talk about boundaries. He was got up, walk around her house. I was saying, right? So I've done, I'm trained as a forensic psychologist as well, and I was very intentional about not having using my personal address. I never, for that reason, had clients come to my home. So, she's disclosed she's also a single woman. Like, it's just like thinking about her safety, right? Like, having clients come to your home in your living room, like there's not an office in your living, to me, like that seemed a little odd, right? And he's walking around looking at her family photos, walking behind her. I think the question I asked as well, have you ever been afraid of a client?
Absolutely.
Yes.
Absolutely. I've been afraid of some adolescents. And to the point where, yes, our training, what I can say from my training, there were these conversations and times where we talk about where you sit by the door. You're making sure that this is not the person that you're scheduling in the evening. But even just, you don't know what the referral brings. But for her, this referral is court ordered. And I think that as a woman, as a woman of color, if you're working out of your home, I think she can be a little bit more strategic about the clients that she would bring. And then even if this was the case, I think we go back to the boundaries, right? I wouldn't be disclosing my dad's an architect that has built the houses around here. Exactly. I wouldn't be disclosing that I am a single woman. Yeah. I would have on a ring. I'd be talking about, my football husband is coming home in about 2 hours. Because why?
But that's not honest then, though. But that's
listen. You hear me? My football husband, yes, he is. He's coming back. He will be here. I would have photos up. That if you're gonna do that and it's gonna be out of your home, like I don't like the boundaries. I wouldn't even do that anyway, but I wouldn't be disclosing that I am a single woman. I'm here at night by myself. Come on, right? Like that wouldn't be safe. It just wouldn't be safe. And I think that she disclosed again too much of herself.
Yeah.
And this patient is going to use that. Yeah.
Right, this is session 1.
So there's something there that she's working through. I mean, I think that for the audience, like to show that even as therapists, like just like doctors, like, physical doctors, it doesn't mean that you're a physical doctor, that you don't go and get your annual physical exam and you don't do your things. Like we have to be in a healthy place in order to be able to help others. So we're seeing kind of like these little things that are coming through that she needs to work through, like grieving her father, just like, and we don't know a lot about her outside world. It's almost like it's also not good if your patient that's your, social world.
Right.
You have your own set of friends and things like that. So I wonder about that with her.
So, right. So we'll see. I mean, clearly, right, it came up in both sessions right away. The death of his father, which again, we're human, so we're going to experience those things. But clearly there seems to be, and I think this, when I watched back some of the season with Paul, there are also some boundary issues.
Yeah.
And they're definitely clients we like, right? And sometimes it's kind of like, there's the line, but you still have to hold that. There are a couple things. So about Colin, I'm curious. I definitely have clients swearing session, right? And I try not to like police that space, right? Because I want to be free. But there's some vulgarity in his speech, and like, is that something you would set a limit with? Like, how would you deal with some of the vulgar comments he was sharing?
Yeah, he was definitely very provocative. So I'm glad that in her style, like she put him back in his place. So I think it's something like that, because I would have done the same thing too. Yeah, okay, yes, I want my patients to feel that like themselves, as he was saying, like I wouldn't be myself, fine, but you also have to be respectful. Because if it becomes malicious, right? Because it did become malicious, where it was like very well intended to provoke her.
Using the C word, right?
Yeah, exactly.
and acting like it's nothing.
Yes.
Yeah. I mean,
but testing her.
Yeah, he is testing her.
Yeah. And I would have wanted to just call that out. Like, okay. And I think she did a beautiful job at that. Like, this is the part that I love, because with the first time he said it, she kind of just danced with that a little bit, and then by the third time of him giving the example, she's like, okay, let's, and I think it was once he got to the point where he was talking about the other therapists he slept with. And how about you? Have you slept with a client? And now it's like, okay, let's do this. Let's have this discussion, because what I see you doing is not trying to have this type of conversation in here. You don't really want to engage in anything that's of a healthy conversation. You're provoking me into this. And if that's the behavior we need to address, let's do that.
Yeah.
Let's do that. Let's have that conversation. Right. But what's not going to happen is that you're going to use these, you have 4, and she did beautiful. You've got 4 sessions, sir.
Yeah.
That's it. Why?
And I'm not going to write a letter saying you're good. So,
yeah.
Because, and she checked it. Your probation officer came in and said all of these things about you. You denied all of them. Yet in 30 minutes, you have done all of them to me.
Yeah. Yeah.
Mm-hmm.
So you don't need to be here. You don't have no anger. Like when he's saying that he's not physical. He didn't have any, and he's never violent. He doesn't have any physical altercations. Sir, you've been here 30 minutes.
He's angry, right?
You are
like assaulting her with his words. That's
verbally aggressive.
Mm-hmm. And I think you picked up also the racial piece that, HBO, come on, HBO, y'all gonna do this from this lens? Like, okay, corporate crime, white male doesn't see that as a problem. Why? This is not a big deal.
It was like
I didn't do anything wrong.
He was like the example for people. Mm-hmm.
He said, I didn't do anything wrong. And then it was like, I did. It was a crime, but
just moved a couple decimals.
Right. Like, no big deal.
It was like, fraud is a crime. Just like, in case you didn't know.
But he minimizes, right? He's been minimizing.
Yeah.
So there was one thing she said that I was like, ooh, I wouldn't say that to any client regardless of how they present, right? When she said to him, and that when she was responding back to him when he was being provocative, she said, you're beyond help.
Oh, yeah.
Did you hear that, Vanessa?
No, I didn't hear that. Oh, see, there's just like, there's things like I have to.
Yeah, she was like, something she was going on. She's like, I'm not, you're are we going to say that you're beyond help? I'll listen to it again, but even
she asked the question,
the client is pushing, like there's certain things I won't say to clients, right?
I agree.
Because it doesn't make the space safe. And we talked also about this really, I think, even though he was kind of minimizing and not being forthcoming, I think it's court ordered, right? Mm-hmm. We don't know what she said about what happens to what he tells her. Yeah. Did she go back and tell the court, the probation officer, or is it confidential between them? And I think that's really important, because he might be like, this is not private, so why am I going to disclose stuff to you? And then you're going to tell the probation officer. So court-ordered therapy is very different, and you have to be clear who the client is, who has access to the information that the patient in front of you is sharing, in order to be able to build that trust. So that was very interesting for me, again, because of the work that I do. That is always very clear. You have to be clear with clients about that. But yeah, so.
No, those patients already are super interesting. Like I'm like, okay, what's gonna happen next? When they show you right?
We had a bet here, so we're gonna weigh in.
Okay,
and then we'll close out. So he has 4 court-ordered sessions. Do you think he'll stay beyond the 4? Shani.
No.
Shani thinks no. 4 and done.
And I say no, because I don't know that I would, like, you're forensic. Here I am, adolescent. I'm like, oh no, he gotta go to you. He's got to go over to you. So I'm like, not only is he getting 4, but he's done after 4, because somebody adult needs to take him. So yeah, I'm done at 4. Let's see what happens.
What do you think, Vanessa?
Sorry about my dog. I said more than 4 just because it's a TV show. that's
Right.
this isn't real life, and I'm also thinking, for those of you who've watched like the season 1 of In Treatment, patient Sophie, the adolescent, it was also kind of court ordered, and she stayed for more than, because it was just like, hey, you got to write me a report saying that I'm not, suicidal. And it lasted more than that. That's the only reason why I say that.
Right.
In real life, it was a patient, probably not.
Yeah, I would say I didn't look at how many seasons, how many episodes will be, but I also think that he might stay more. I think this first session is really about, again, testing, saying if she can handle this.
Exactly.
But he has a lot there to unpack, and he's going to need more. And there's a lot of racial. I want to see what they do with some of the racial, because it came out, right? Like those people, this neighborhood, right? Some of the coded language around race.
You're very entitled, you're making things, but also the other thing in terms of the dynamic, it made me think of the movie Good Will Hunting, when Will, the first session with like Robin Williams, was provocative, right? It was also mandated for Will to go to the session, and then he stayed the whole time. So that's
yeah. I love that movie too. Yeah. So any final words, any takeaways? What else did I want? Let me just check and make sure we covered what we think we're gonna cover. Anything, right? I think one of the things I also wanted to make sure we talked about, and again, like any misconceptions, because I think people are going to watch the show and they're going to think, okay, this is how therapy is, right?
Yeah.
And I know it's funny. I still have to figure out how I'm going to respond. Many shows really kind of portray therapists really inappropriate ways. I would say, I think I might have mentioned this to you, Vanessa. The new Jamie Foxx show, Dad, Stop Embarrassing Me.
Oh gosh, yes.
I watched with the therapist. I'm like, come on, man. Not in 2021, when our people are needing therapy. Like, we can't do that because people, they don't know. They don't know what happens behind the door, so they think that that's real. So I love that HBO really does a good job portraying therapy in a realistic manner. And but yeah, so any
semi,
right?
I think that one of the things,
TV show,
because they've got to get right to it. I think one of the things that we're missing here is that, and I want people to understand, those first 2 sessions of information gathering, sometimes 3. Yeah. So where they are, like, to me, what we're seeing is the 3rd or 4th session.
Yeah.
Because those first couple of sessions is your clinician asking a lot of information, going through your childhood, going through your level of education, your family style. And it feels like I've had friends that are like, well, I just spent 45 minutes talking about like where I went to school. And you're frustrated because you're not getting to the meat and the root, right? But the clinician needs all of that information to assess for treatment, to assess what the treatment goals plan should look like. And so what's going on in these sessions, I feel like, is after session number 2 or 3, right? Of really gathering that data. And I've had friends, family members be so upset that they weren't able to talk. And they feel like the process is a waste of time because they see an HBO show, and the HBO show started off and it went right into it. And your clinician is like, still like, oh, so you went to, you went to O'Brien's and you graduated, and you're like, wait a minute, I don't want to talk about any of that. And so that's the reality. And I hope that people understand that and be patient with us. We're just trying to gather the information.
Slower.
Yes.
The process is slower.
Yeah. And as you were saying, Shani, it's just like, the way in which the therapist in the show, she was able to make connections, right? She was able to challenge the patient, but you need to have that information. So we need to collect the information to get a clear picture of what is going on. So then we can help you make the connections in your life. We can help you. It will enable us to know which direction to go to help you. And so if we don't ask these questions, we're not going to know.
Yeah. Right. Exactly. Right. And, the thing that I would end with is that, we work as therapists, we work hard to create a safe space. And again, I think she is, again, the way it's portrayed, there's some foundation work that she has done that we haven't seen, right? I do think it went really fast for this first session with Colin, because we're seeing in this, in theory, the first session, she read the notes. But, it's really important, again, that people understand that it is a safe space, and we are working hard to make sure that you feel comfortable.
Absolutely.
There's a lot of work we do in talking about our own style, what you want. Like, there's a lot of negotiation that goes on in those first couple sessions, for sure.
Absolutely.
Yes.
Absolutely.
Cool. All right. So we have a few viewers, so thank you all for coming.
Thank you.
We'll be back tomorrow night at 10. The next two, I wrote the names on, I forget. I think it's Layla, and there are 2 episodes tomorrow with the next 2 clients. So we'll be back at 10 o'clock tomorrow to debrief.
Yes.
All right.
All right.
Good night, everyone.
Good evening.
Bye.
Bye-bye.